Many local companies are calling their employees back to the office. But what if you're one of those workers who's at high risk for COVID-19? Dr. Maria Simbra has advice from local doctors about what precautions you should take. New at 6.
Some people are not looking forward to no longer working from home.
Surveys show that now that we're reopening up, a majority of Americans are concerned about going back to the workplace.
Especially for people at higher risk for coronavirus.
People who are older, particularly those above the age of 65, people that have underlying conditions like diabetes and heart disease and lung problems are at a higher risk from getting COVID complications.
People that are in their 50s and 40s who take high blood pressure medicine are also considered higher risk.
Age is a known risk factor for more serious outcomes.
Doctors advise their patients with consideration for their individual needs.
Some people actually change their jobs based on wanting to avoid contact with individuals that they knew were going to have COVID-19.
It's best to stay home if you can.
But not everyone can change jobs or stay home. If someone in these high-risk groups returns to work, they should take extra care.
The most effective mask that you can wear to not touch your face or your eyes, clean off typing surfaces, clean off things you're going to touch when you start work.
The masks need to be worn over the nose and over the mouth.
The workplace must do its part too.
What is the employer able to offer to that worker, understanding that they're vulnerable? Can they have a physical barrier? Can they have personal protective equipment? Can there be specific ventilation measures? Can they be reassigned to have less contact? There's a whole toolbox of things that an employer can do, and they may want to prioritize those for the older worker.
Make sure the place where you work has thought about how to minimize disease.
Some people feel the risk isn't worth it.
I've had people who've made that decision that they're simply not going to go back to work, that they're going to retire.
These are very difficult discussions in terms of the worker deciding, is this worth my health to go back? What I always tell my patients is that your health is above all the most important.
Being healthy to work and working to be healthy can be a challenging balance. I'm Dr. Maria Simbra, KDKA News.